Then there are the patients that come to see us. They're the ones that are in this third phase. The third phase is when the patient has moved into having an autoimmune disorder. So we have to talk a little bit about the immune system. Are you still with me? So that you can understand what an autoimmune disease is. So who knows what an autoimmune disease is? Raise your hand. What's an autoimmune disease? Right, so if you Google autoimmune disease, I got to learn about autoimmune disease, it's going to say when your body attacks self-tissue. But we want to expand that a little bit so we can understand what that really means. So it's not your body attacking self-tissue. What is it? Well, it's actually your immune system that's attacking self-tissue. Well, it's actually more specific than that. It's actually one part of your immune system that is attacking self-tissue. So then we got to understand what the immune system is just a little bit. So bear with me, this is really important. Put your thinking cap on. Your immune system has two major pieces to it. It has some other pieces, but we're going to talk about two major parts of the immune response. So if I come in this room and somebody breathes a cold virus on me, and that cold virus goes into my system and starts circulating around my blood, and it reaches a certain point, it's going to stimulate an immune response. Right? Hopefully, if I'm healthy enough, it's going to stimulate an immune response. There's two sides of the immune system. There's the immediate response system, and that's called the Th1 side of your immune system. So your Th1 side is your immediate response, your cellular response. Then you have what's called a Th2 side. So when I'm exposed to a virus, or when you were initially exposed to Lyme pathogens, you fired a Th1 side. So this Th1, Th2 really holds a balance. It's never perfectly balanced, but it's always fluctuating like this because we're always exposed to pathogens, right? So you can't touch anything or breathe anything and not breathe in a pathogen that's going to go into your body, and your immune system kills it. Your Th1 side is the side that initially fires. So the Th1 side, if we could put it into a cartoon, they're circulating through your blood with machine guns. They are your Marine Corps. They are the killer cells. They're the macrophages. There's a whole bunch of different chemicals in that Th1 response, different what are called chemokines and cytokines that will fire against a pathogen and kill a pathogen. They do one thing, and they do it well. They kill things. That's all they do. So they are looking for a fight, and they are going to find something to kill, and they're going to kill it. So they're kept in balance by the Th2 side. The Th2 side does some killer cell response, but very little. Main responsibility for the Th2 side of your immune system is to balance out the Th1 side and to make antibodies. So, real case scenario, I'm exposed to a cold virus, my Th1 side fires, it kills it, it goes back into balance, and I never knew I was exposed to a cold virus. Right? It's a really bad cold. Fires, can't kill it, your body kicks in some more cytokines, fires a little bit higher, kills it, goes back into balance. Oh, I just didn't feel really that great today, but I'm fine again. It's a really bad flu. Fires, can't kill it, can't kill it, can't kill it, fires this huge Th1 response. I got a little fever, I don't feel good. Do I have a fever? Yes, I got a fever. I gotta go home, I feel sick. That's what a fever is a hyper Th1 response. So, it's trying to kill this virus. It can't kill the virus. After about 24 to 48 hours, your body suppresses the Th1 response, fires a Th2 response. The Th2 cytokines kick into gear. Their job is to, if we could cartoon it, this is the Marine Corps, this is the FBI. So their job is to, all right, we got to do surveillance. We got to figure out what these guys, the Marine Corps, is trying to kill, and we got to tag it with some fluorescent tape called an antibody. There it is. It's Borrelia. Let's tag it with some fluorescent tape. Let's make an antibody against it. So we're going to make antibodies against this Borrelia, right? Then this side suppresses, the Th1 side fires again. Oh, there you are, and it can kill it. So if it was my flu, I got this flu, couldn't kill it, had a fever, went homesick, didn't feel good, laid in bed, ate chicken soup, my Th2 side fired, made antibodies against this influenza virus, my Th1 side fired again by the end of that night, was able to kill all that influenza now because it was all tagged with these nice little fluorescent antibodies that tagged it so it could see where it was supposed to shoot. It killed it, it goes back into balance, and I'm back at work the next day. That's a healthy immune response. That's not an autoimmune disease. That's what happens when we get sick, hopefully. Problem comes in is that if my Th1 response fires against a pathogen, and it can't find the pathogen because it is something like Lyme pathogens that have the ability to hide within the cell, and my Th2 response fires to try to find it and tag those Lyme pathogens, it can't find it. Th1 response fires, you go through this cycle a few times, maybe over the course of days at worst, usually months, you start making antibodies against things you shouldn't make antibodies against. Here's the, let's put it into a cartoon. Here's the FBI. We cannot figure out what these Marines are trying to kill all the time, but we know it's somewhere here in the brain. So let's start making antibodies against these neurons. Then, when the Th1 side fires, it starts destroying your own cells. That's an autoimmune disease. So an autoimmune disease, when your body's destroying itself. Well, it's when your Th1 or Th2 response of your immune system is killing your own cells because you're making antibodies against your own tissue because somewhere in that vicinity there is a pathogen that has not been able to be found. Does that make sense? I have Hashimoto's disease, low thyroid. My doctor said I have Hashimoto's disease. That means you're making antibodies against your thyroid. So I got to be on Synthroid the rest of my life. Well, you probably do have to be on Synthroid the rest of your life because you have Hashimoto's disease. Did your doctor ever ask what is the antigen? The antigen is that which the immune system is turned on against. How are we going to get rid of this antigen? Are you stuck in a Th1 dominance or are you stuck in a Th2 dominance? They ever ask these questions? And usually the patient goes, I have the faintest idea what you're talking about. Nobody's ever told me about this at all. So, has anybody heard all this before? You guys specialists in this yet? No? You need to read the Help My Body's Killing Me book. This is where I outline what an autoimmune disease is. And if you are past that acute infection with Lyme, and you are not in that, I can control my Lyme with herbals, then there's a pretty good chance that you're in the, I have autoimmune disease, and nobody's ever told me that. My Lyme has gone intracellular, not only in my joints, not only in my cerebellum, not only in my frontal lobes, not only in... Now my body is making antibodies against those cells, and every time my immune system flares, it's killing me. Literally. So honestly, I have doctors that call me weekly, at least. Hi, I got a patient. I can't figure out. They got this and this and this autoimmune disease, and I have them on blah, 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 and they're getting worse. What should I do? Well, maybe take them off blah, 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 blah first. And my question is, what's the antigen? Are they Th1 or Th2 dominant? Well, I have no idea. Okay, well then you have no business treating them. Sorry. If the person has known Lyme disease, I know I have Lyme disease, that's not a question. And they have these neurological symptoms, symptoms that aren't abated through taking some herbals or something like that, and they're in the autoimmune phase, then you have to find out some of these answers if you're going to help this patient.